So the indirect matched comparisons of these agents, of like the other JAK inhibitors, will be probably the only way for us to see some kind of head-to-head comparisons, although it's very indirect and it's matched. So there's no head-to-head comparisons of these agents. The only direct head-to-head in frontline patients with myelofibrosis was the Simplify one, Momelotinib versus ruxolitinib. So now onwards, because now we have 4 JAK inhibitors available, probably this is going to be all we're going to see, how these JAKs compare to each other. And in the MATCH, which is the indirect matched comparisons, was Momelotinib data from all available randomized studies, and then either one study for Pacritinib and the other for Fedratinib, which are all excellent JAK inhibitors approved for patients with myelofibrosis. They just faced in a different level of the disease or how they given. So Momelotinib is agent approved for anemia. Pacritinib is a great agent approved for patients with severe thrombocytopenia, and then Fedratinib doesn't have, none of them has any other line, so they could be used frontline or secondary. And Fedratinib is an agent basically that has the strongest JAK2 inhibition, so used for patients with large spleens or symptoms, mostly picked as a second-line setting because of side effect profile. And these comparisons particularly looked at the side effect profile, and actually after matching these patients from the studies for baseline characteristics, they were pretty broadly done. While still the estimated sample size remained quite reasonable, the comparison showed that Momelotinib had favorable profile for the incidence of most important adverse events, particularly hematologic, which we know Fedratinib is an immunosuppressive JAK more than Momelotinib or Pacritinib, because all the other 2 are approved in cytopenic setting. And then mostly for gastrointestinal, such as overall grade or grade 3, nausea, vomiting, diarrhea, where Momelotinib shows superiority for actually against both of these agents. So separately for Pacritinib patients as well as Fedratinib patients. So I would just say that this just gives us a little bit more room into how to face and choose these JAK inhibitors. I'm in an opinion all of them are necessary. We need more JAKs for our patients. They all have a different approvals. They all have a different setting and usage, but just be more conscious for what the side effect profiles of these agents offer, and particularly for drugs that offer or gives more gastrointestinal toxicity, use preventive measures to avoid it, so patients could tolerate the drugs and remain on the medications for the longest benefit.